Hi everyone. Hey everyone, it's Dr. Chook from the Toronto Concussion Clinic, and today we're going to show you a balance exercise. It's a very fundamental one. Many of our patients have balance issues, and a common thing that comes up is that when they start to lose balance, they lose all core stability, and when you lose that core stability, it's hard to kind of stay grounded. And we need you to stay grounded because if we want to kind of train up the vestibular system and eventually the visual system and so on, having that solid foundation is really important. And in fact, that's the way we all developed as children, so we're just going to do it again. So one of the things that people don't use that much, especially people who live sedentary lifestyles, is they don't activate this muscle called transverse abdominis. So it's like a corset-like muscle. It comes from your ribs down to your pelvis, and it spans all the way around. And it's the connection between your lower extremities and your pelvis and your upper extremities and your thorax. And so if that gets all limp and loose, you have very little control over your center of gravity. So we teach people to turn that back on, and oftentimes we start when we're lying down, and Mo showed you a video on that, our assistant Mo. So I'm going to show you how we kind of use it in standing. So when people are standing and you're breathing diaphragmatically, the most efficient way of breathing, you have to relax the transverse abdominis a bit to allow it to expand. Okay? So if you breathe like that, you'll feel that this gets more tense as you take that diaphragmatic breath. Now, a lot of people, when they're learning this for the first time, once they exhale, it all gets loose again. So that means you're going to stay firm and connected, upper extremity to lower extremity, only when you're breathing in. So ideally, we'd like you to keep that tone even when you're exhaling. So when you're breathing in, the diaphragm comes down. You have to let the transverse abdominis expand. And then when you're breathing out, you still want to keep the tone in the transverse abdominis, but the diaphragm will come back up. But you're still keeping that tone, so you keep that connection, so you have more control over your center of gravity. And then, some people only kind of breathe with their diaphragm going forward like this. Right? You want that air to kind of expand. You want that diaphragm to kind of come down throughout your whole torso and allow the expansion to even go into your back. So, see, it even expands into here. It gives me a lot of stability. So now that I've done that, I'm going to take this foam here, and you can use a couch cushion at home, and I'm just going to get you to stand on that couch cushion, okay? And try to stand with a posture we've shown you before, or a posture that your physiotherapist has shown you. And just get used to the effect of the breathing on your center of gravity, and feeling the connection between your pelvis and your thorax. Feel how your diaphragm, when it comes down, your transverse abdominis has to expand in both directions. And as you exhale, see what happens if you lose all the tone in your transverse abdominis versus if you keep it alive. lot of people, they breathe with their chest. See the difference it makes on your balance too, because we're going to want to incorporate that into your balance training. We're going to want to incorporate a stiff transverse abdominis, and we're going to want to incorporate diaphragmatic breathing as a pump to maintaining the transverse abdominis taut, or kind of a turgor pressure, in addition to all the other benefits to breathing diaphragmatically. Eventually, we will use that as a tool to more complicated movement patterns, and it's something that's even used in high-end athletics, where they have, a lot of them not even intentionally, but they do train it on how to keep that tension there so that they have more power. Remember, power does come from balance. Sometimes that's a great way to gauge if you're doing it really well, is if you can generate more power, but we'll get into that in another video. All right, I hope this was helpful, and I know many of you might not see how this relates to balance, but if you can, go ahead and get a couch cushion and give it a go. See if you can feel the influence of diaphragmatic breathing in maintaining that tension in your midsection. And then as we progress into other movements, you'll see what kind of effect that has. I hope this was helpful, and we'll come out with another video to help you on your road to recovery.